Hey moms, welcome to Mama to Yoga Academy. I am Claire Newman, the program director. I wanted to make this brief video on something that I think is really important that I teach my students in prenatal yoga. And that's something called counternutation. So just to let you know that these movements are within the SI joint, so that's the sacroiliac joints within the pelvis. One movement is wonderful for moving baby into the pelvis, and the other is for birthing. So when the baby's head is crowning, and then we usually give 1 or 2 pushes just to move the baby through the pelvic outlet. So I always teach moms these because I think it's really important to know and understand that you can actually move these SI joints in your pelvis to transition baby into the pelvis. So they're wonderful additions. I want you on hands and knees if you want to try this position for yourself. It's really similar to cat-cow, but there's a little difference because, again, we're not moving from the lumbar or upper thoracic spine. We're actually moving from these SI joints in the pelvis. So counternutation really mimics the movement of like a pelvic tuck, so moving into our cat position in yoga. And then nutation is, of course, the opposite. It's more of a pelvic tilt, and it would be mimicking kind of the movements of cow. So just, again, one last time to let you know that they are not movements from the lumbar and upper thoracic. These are movements from the SI joints. So they are incredibly small movements. So I'm going to come onto hands and knees just to show you what I mean by this. And it's kind of interesting to be so bright. So just to keep in mind, in a neutral position, your wrists are underneath your shoulders and your hips are over top of your knees, of course. And we're keeping a neutral spine. So if you're practicing this, of course, in pregnancy, we're hugging onto baby to make sure that we're not collapsing in our low back in this position, that we're finding more neutrality. So we reach the crown of the head forward and the sit bones back. So again, if I was to move into a cow position, I lower or tip the pelvis forward, reach the sit bones up. You can see that there's a lot of lordosis or extension in the back. And then the opposite in our regular practice is then pressing down through the index fingers and the thumbs, creating our cat position with more of a thoracic position. So we're not doing that. Here's how small these movements are in this position. So finding neutral spine, hugging onto baby, just looking down so the neck is also neutral. Now I want you to draw the sacrum back, kind of compress and squeeze the sit bones together. So this is our counternutation, and it's opening the pelvic inlet to help baby transition in towards the pelvis during labor and delivery. And then the opposite direction, nutation, you're going to draw the sacrum forward, so kind of pointing down towards the floor or at least towards the pubic bone, and lift the sit bones up, spreading the sit bones apart, so your ischial tuberosities. And this is creating a widening to help, of course, birth baby. So we have an optimal labor position, tuck or draw the sacrum back, squeeze the sit bones together so the pelvic crest and inlet is opening. And the opposite position, we're lifting the sacrum up or forward, lifting the sit bones up in this position, so we're widening the space between the sit bones for birth. So you can see I'm going to go counternutation again. So sacrum back, squeezing the sit bones together, and then the opposite direction, sacrum forward, lifting and spreading the sit bones apart. So you can see how small those movements are in this position. I'm not over-exaggerating my lumbar and upper thoracic. So play around with these a little bit on hands and knees in your position if you're pregnant. And just know how amazing your body is, especially this bony pelvis, and that you can actually articulate the smallest movements within your pelvis to help both with labor and delivery and birth. Awesome. If you're a yoga instructor, I always implement or teach this in my class for moms because I want them to know and educate a little bit more about how fascinating and how strong and how phenomenal the bony pelvis is, but as well as what they can do to be so conscious and aware during labor and delivery and, of course, birth. So happy learning. I hope that you love the counternutation and do a little bit more research if you choose, but incorporate it as a little different of a practice in your class.